Hello, folks, and welcome to our ninth episode of The Virtual Psychiatrist. This week, we talk about HIPAA, or the Health Insurance Portability and Accountability Act, which was established in 1996. It initially aimed to protect patient information while facilitating the seamless exchange of medical records. But in practice, we've seen significant challenges, especially with the rise of electronic health records. The recent United Health Group breach, 191 million records compromised, highlights how vulnerable our healthcare systems are.
Wait, 191 million? That's like, whoa, that's half the US population or more. You're saying someone could swipe a couple 100 million people's personal data without repercussions?
Exactly. Thank you, Norm, for co hosting with us today. What you said is part of the problem. The penalties for HIPAA breaches usually focus on individual healthcare practitioners rather than systemic failings. We're talking millions of people's sensitive health information, full names, dates of birth, social security numbers, likely for sale on the dark web.
But here's the thing, can you even call it a law if no one's enforcing it properly? I look at hospitals and these massive corporations, they're barely getting a slap on the wrist. Meanwhile, frontline docs and nurses get dragged through the mud for minor mistakes. What's going on there?
It's a disparity in enforcement, Norman. Executives at these organizations rarely face prosecution, even when their negligence causes these breaches. The mechanisms for accountability seem flawed at best. Technically, every single data breach is a HIPAA violation, but enforcement has shifted to public reporting rather than criminal or civil penalties.
Yeah, and doesn't that just send a message like, hey, screw up on a massive scale, we'll look the other way. But if you're a small time practitioner, buckle up. It's your head on the chopping block.
Precisely. And speaking of accountability, most adults in the US, 85% by some estimates, have their health information available for exploitation. This isn't just a data issue, it's a trust issue. Patients are losing trust in the system.
And they should, man, they should. When you've got laws that are toothless, no real consequence for executives who play loose with security, it just feels like the healthcare system's prioritizing profits over people.
And that undermines the entire purpose of HIPAA, protecting patient privacy while advancing care. But Norman, this conversation isn't over. Let's dive deeper into what happens when someone actually gets prosecuted for a violation, like Dr. Rita Luthra's case.
So you are telling they prosecuted a doctor for this hip mumbo jumbo.
Yes, Norman, the Dr. Rita Luthra's case, which really illustrates the issues we've been discussing. In 2018, she was convicted for allegedly giving a pharmaceutical sales rep access to patient data to assist with insurance approvals. But here's the shocking part. This wasn't about exploiting sensitive health information. No, the entire case turned on the absence of a business associate agreement. Just one piece of paperwork that would have made her actions compliant under HIPAA.
Wait, seriously? They threw her under the bus because of a missing form? A form?
Yes, Norman. And that's often the reality for physicians. There's little consideration of the intent or context behind these actions. Dr. Luthra's case highlights how harshly the law can be applied to individuals compared to large organizations, where similar, if not worse, violations are glossed over.
And what did she get for it? Jail time.
She actually got probation, but the conviction wrecked her career. She lost her medical license. It's a clear example of how the justice system targets individuals, especially practitioners serving marginalized communities while powerful entities escape unscathed.
Man, it makes you wonder if HIPAA's all about trust and protection, why does enforcement feel so skewed, like it's weaponized against the least powerful?
Exactly. And that brings us to Dr. Ethan Heim's case. He was accused of exposing medical records while blowing the whistle on gender affirming care practices at Texas Children's Hospital. It turned into this politically charged storm with prosecutors targeting him despite the records being redacted, containing no identifiable information.
Yeah, I know about that one. Haim claimed he was uncovering hypocrisy, showing the hospital was still providing gender affirming care after saying they wouldn't. And for that, boom, they got him on HIPAA.
That's right. Eventually, the charges were dropped after significant political pressure, but the damage was done. His reputation, his livelihood, it all took a hit. It shows how HIPAA can be wielded as a weapon in politically sensitive situations.
So basically, the system picks and chooses who to punish depending on who's convenient to target. If you've got the right connections or cash, you're fine. But if you're just trying to do your job, or worse, stand up for what's right, you're toast.
And that's the heart of the issue, Norman. These cases highlight the disparity in enforcement. Physicians who make administrative errors or act ethically under challenging circumstances are criminalized, while large scale breaches by corporations are met with little more than a shrug.
It's systemic injustice, plain and simple. We've got a law meant to protect patients, but instead punishes the people actually trying to provide care. That's not just flawed, it's dangerous.
Dangerous and deeply discouraging. If the system can't hold the biggest offenders accountable, how can we trust it to uphold privacy or fairness? But let's pause here. Next, I want to discuss the case of Linda Sue Kalina and how her actions underline the need for robust systems to prevent insider misuse of patient information.
Let's hope it is some real crime that these crooked feds are prosecuting someone for. Hey, well.
As we've seen, Norman, enforcement under HIPAA can be uneven and politically charged, but let's not overlook cases of clear insider misuse that justify strong safeguards. Take Linda Sue Kalina, for instance. Back in Pennsylvania, she worked as a patient information coordinator and deliberately accessed medical records she had no business touching. She went through data from over 100 patients and even disclosed some of it to cause harm.
Whoa, wait a second. She wasn't just snooping, she was actually using that info to hurt people?
Exactly right. And that's what makes her case stand out. This wasn't a mistake or a slip up, this was intentional misuse. Kalina was charged with multiple HIPAA violations, and the courts didn't go easy on her. They made an example out of her with federal charges because insider threats like that erode trust in the system just as much as massive breaches do.
Yeah, but here's my question. How do we stop this from happening in the first place? I mean, how was she even able to access so many records without anyone noticing?
Great point. It boils down to inadequate monitoring systems. There's this huge gap in oversight when it comes to who's accessing patient data. Many healthcare organizations simply don't have the tools or the willpower to track employee activity and flag suspicious behavior. That's a systemic failure we need to address.
But isn't that just another layer of stress for healthcare workers? Like, you've got people already stretched thin working in chaotic, high pressure environments. How do you enforce this without making their jobs even harder?
It's absolutely a balance. And you're right. Frontline healthcare workers face constant challenges maintaining HIPAA compliance. Picture this: you're doing patient rounds in a crowded hospital with only a thin curtain between beds. Technically, discussing cases there is a privacy violation, but what choice do you have?
Right, right. You've got patients everywhere, families in earshot, and staff rushing to keep up. It's impossible to be perfect in that kind of environment.
Exactly. And most of those unintentional breaches get overlooked because they're a result of structural limitations, not negligence. But then cases like Kalina's muddy the waters. They make it harder to differentiate between what's intentional harm and what's just the nature of working in a broken system.
So, what do we do, Doc? More penalties, heavier fines, or are we talking about fixing the whole infrastructure?
It's got to be a mix of accountability and reform. We need better training to help healthcare workers navigate these gray areas and robust legislative changes to ensure equity in enforcement. But it can't just stop there. The focus should be on proactive measures, building systems that prevent misuse of information before it even has a chance to happen.
Proactive, huh? Like monitoring tech, policies that actually protect workers while holding the big guys accountable.
Exactly. Enhanced auditing systems, for one, can spot unauthorized access in real time. And there also needs to be support for workers in high pressure settings, guidelines that are both practical and fair. This isn't about punishing people just trying their best. It's about creating an environment where breaches become an exception, not the norm.
But until then, it feels like the system's always chasing its tail, reacting, pointing fingers, instead of building something better. I can see why people feel disillusioned.
And that disillusionment, Norman, is the heart of it. People deserve a healthcare system they can trust, one that values privacy as much as it does profit. Now, let's explore how these challenges get amplified with large networks of electronic medical record systems like Epic.
More surveillance, more snooping. What the hell? This HIPAA deal was raw from the get go.
As we delve deeper, Norman, let's talk about Epic and other massive electronic medical record systems. These platforms were designed to streamline access and improve care, but they bring with them some unsettling trade offs. Are they really building trust, or are they adding to the disillusionment we just talked about?
At what cost, indeed? I mean, yeah, it's convenient, quick access, no paperwork flying around. But you're also talking about what? One big, juicy target for hackers.
Exactly. These interconnected systems are a double edged sword, unparalleled convenience for providers, but also an unprecedented risk to patient privacy. A single breach can expose millions of records. And the fallout isn't just financial, it's personal. Trust in healthcare institutions crumbles.
And that's why, right now, more and more privacy conscious patients are saying, forget it, take me off the grid. They're going back to paper records, like literally asking their docs to ditch the digital.
Yes, and it's ironic, isn't it? Technology was supposed to simplify and secure healthcare, but now some patients feel safer with good old fashioned paper charts because at least those can't be hacked. It's creating a dilemma for providers caught between modern efficiency and patient preferences.
But here's the kicker: HIPAA itself isn't easy to navigate when you're dealing with paper or digital records. Docs are stuck in this gray zone where they're trying to maintain strict compliance, and it ends up slowing down care. Like, how do you treat someone effectively when you're tiptoeing around 100 rules?
Precisely. HIPAA's privacy rules, while well intentioned, often add layers of administrative burden. For example, keeping patient conversations private in overcrowded hospitals or during rounds can feel almost impossible. And Norman, let's not forget the penalty specter, how it hovers over practitioners for even inadvertent breaches.
Right? Like the curtain between beds situation you mentioned earlier. Talk about setting people up to fail. It feels less like protecting patients and more like tying caregivers' hands behind their backs.
Exactly. It's about balance, Norman, about finding that middle ground where we protect privacy without compromising care. The problem is our broken systems emphasize fear over trust, punishment over progress.
And patients see that, doc. That's why they're frustrated. You've got tech that does amazing things but also opens giant loopholes. You've got laws like HIPAA making simple tasks monumental. And in the end, it's the patient and the provider who pay the price.
You're absolutely right, Norman. And that's why this conversation matters so much. It's not just about fixing the tech or reforming laws, it's about restoring faith in a system that should, at its core, serve patients first. You've said it best. Healthcare has to prioritize people over profits.
And change won't come easy, but it's conversations like this, diving deep into the cracks and complexities, that can nudge the needle forward. And on that note, Doc, it's been one heck of a ride unpacking HIPAA with you.
Likewise, Norman, a critical topic, a robust dialogue. And to our listeners, thank you for tuning in. Let's keep the conversation alive, keep advocating for change, and together, let's strive for a more equitable healthcare future. Until next time, take care and stay informed.
Folks, always remember you are within the norms until next time.